this is basically, it's not about the hormones themselves, it's about the hormones going to their targets. You got the receptors and you have the hormones, and how do they talk inside the cell? All right, so it's a little bit of cytology. We got to deal a little bit with membranes and what's happening with the proteins. So that's why I have to assume that you guys did that part, okay, in fundamentals of biology. Okay, so this is about the target receptors and the hormones themselves, okay? So you know about the similarities and differences. Don't forget them between the nervous system and the endocrine system, okay? Yeah, it's right after, you'll see a big reddish here. You see it on there? Is it, I don't know what page, because I have a page. You got the page where we go? All right. So hormones. Like I said, there's about 60 or 70 different hormones. I'm not going to have you know all of them, but a good 35, 40 by the end of the course. We're going to do a bulk of them, you know, in the next couple weeks, but then we get the reproductive and the heart and stuff. We'll mention a couple more after, you know, during that time. But by the end of AMP2, you'll have a lot under your belt. So these get released directly into the bloodstream as you saw before. That's what makes it a hormone. All right? They affect a few cells to the receptors on the target or organs, and they mostly act on organs that are not near where it came out of. Like I said, my pituitary gland over here is going to release a hormone, follicle stimulating hormone, and it's going to go to my testicles. Does that make sense? Which is a far distance when you think about it. Okay? So it's not like right next to it. Some places it's right next to it, but most of the time it's far. All right, so this is just a synopsis. We'll go through these things as we go along, but people, you know, students like to see, you know, an overview of what this is. Okay? All right, so how do cells or organs tell another organ what to do? Now, I have my parents in New Jersey. Here I am in Massachusetts. Now, there's a lot of ways I could communicate with them, my parents. I could call them up the old-fashioned way. I could text them. I could send an email. If you go really back, I don't even know if they have telegrams, but I could do that too, right? There's a lot of ways that things could be communicating to one organ to another, and that's what we have over here, all right? We could have hormones. Like I said, this hormone goes directly into the bloodstream and goes through the whole thing. Like an email would go through the cyberspace, so to say, right? We could have an autocrine. Now, an autocrine is some sort of cell, and it releases this autocrine. It does it, this autocrine, not a hormone, but an autocrine does not go into the bloodstream, but it actually goes to another cell that's right next to it, and it tells that cell what to do. Does that make sense? It doesn't need to go into the bloodstream, but how does this know what to do? Because this released an autocrine and its receptors on here and tells it what to do. These are the same types of cells. That's an autocrine. A paracrine is another cell that's in here too, and this cell is going to release something to tell another cell that is not the same type to do something. That's a paracrine. It's similar to this, except this is going to the same type of cell, this is going to a different cell. So this is your paracrine, and here's your autocrine. Does that make sense? Okay? Pheromones. This is one organism telling another organism what to do, or changes the behavior of another organism. Pheromones is a good example of this. Okay? Ants, worker ants. They release pheromones from their bodies to tell the other worker ants what to do. Stay in line over here, take all the food from the picnic, and move that way. It sends stuff out there. Cats in heat. It releases, these cats release a certain thing to have the male cats go towards them. We have pheromones from us too. But the pheromones change our behavior in a different way. We call that pheromone BO. Are all you familiar with BO? It's spelled out, well, for abbreviation you probably know, BO. right? There's pheromones that come off that do change, at least in American culture, that do change us, right? Change our behavior, like the kind of thing, right? That kind of, it's just the way our culture is, right? But we have artificial pheromones, cologne, perfume, okay? That's what it is. So it's changing the behavior of another organism is what a pheromone is. Then you have a neurohormone, and this is made in the nervous system but acts like a hormone. And two examples of this that we'll get into is oxytocin and ADH. Oxytocin and ADH are hormones that are made in the nervous system but get released, and you'll learn about that. It actually passes into the posterior pituitary and get released that way. And then you learned about neurotransmitters, where it gets released from a neuron to tell another neuron what to do, okay? Or a muscle for that matter, okay? So those are different ways we can do things. You can look at this chart over here, autocrine, paracrine, hormone, little pictures over here to help you. You have a neurohormone where it's made in the nervous system but acts like a hormone, neurotransmitter, and of course these two rats are in love, right? Got the pheromones over there. All right? Questions about those? This is pretty straightforward. Yeah? All right. Now, hormones. Let's spend more time on that. Hormones, they could be different sizes and shapes. But how they work falls in the category of hormones. All right? So they could be proteins, polypeptides, carbohydrates, lipids. They could be different forms. They could be huge. You won't have to draw these out. But I don't want you to think that a hormone is a protein. A hormone is an amino acid, polypeptide. That it's a lipid. It doesn't have to. It's not because of what it's made out of. It's because of how it functions to make it a hormone. But knowing if it's a lipid versus a protein does help you to understand the concept of how it gets inside the cell or tells the cell what to do. All right? So again, this is about the paracrine and autocrine, so I won't spend too much time on that again. You see the picture. Okay? Now there's three ways that hormones tell other organs what to do. It can do it through the nervous system. You get stressed, hormones come out. A nerve is going to tell hormones to come out. We can also do this. Number 3 here, let me do first. A hormonal reason. As you've seen here, this hormone tells this organ to release another hormone. So TSH is controlled hormonally by another hormone. Does that make sense? A hormone is going to release another hormone. As opposed to non-hormonal. The amount of glucose, that's not a hormone. The amount of glucose is going to tell a hormone to come out. The amount of calcium, that's not a hormone, is going to tell you what hormone is going to come out. Does that make sense? So there's only 3 ways that hormones can get released. Either the nervous system is going to tell it to do that, another hormone is going to tell it to do that, or some other substance, not a hormone, is going to tell it to make a hormone to get released. Is that clear? Okay? And you can read this on your own. It's the same thing I just explained to you. You get to have a nervous system doing that, action of substance other than a hormone, and this thing here, the hormonal. So let me do this thing with you, because this should be a little bit of review for you, the nervous system. Okay? Or not the nervous system, the negative and positive feedback. Negative feedback is like the thermostat. It wants to, if your thermostat is, let's use glucose for that matter. Make it easier, related to the medicine. If glucose is supposed to be in your bloodstream 100, a level of 100. If it goes to 150, something needs to bring it back down to 100. If it goes down to 60, something needs to bring it back to 100. That homeostasis, right? Does that make sense? Okay? That's what's going on over here. Is that negative feedback. Now, positive feedback is the opposite. If it goes to 150, if the sugar's supposed to be 100, now it goes to 150. Now it goes to 180. Now it's going to 200. It's going further and further and further from the set point of 100. That's positive feedback. Mostly what happens in our body is negative feedback. Positive feedback is more or less a disease process going on. Your sugar's getting higher and higher and higher. That's not a normal thing. Right? Diabetes, okay? That's not a normal thing. Now, there are some cases when we get into the reproductive system later on, there are some cases where the positive feedback is a normal phenomenon. And we'll get into that later. But most cases, negative feedback is bringing it back to normal. All right? And positive feedback, usually disease state. Okay? So homeostasis, again, you have these values that are going to fluctuate around a set point. Like 100 is your set point for glucose. Okay? And that determines a normal range. Hey, if 100 is what normal is, if it's 112, that's okay, that's normal. Does that make sense? You have a set of range. You know, if it's 108, okay, that's still about, that's still okay. Right? If your body temperature is 98.6, if it's 99.2, you got a normal range. That's okay. Does that make sense? Okay? So that's what it is. You have the set point, and it's a desired value. All right? Now, negative feedback. Like I said, it wants to keep things closer towards the set point. Okay? That's what that is. All right? And that's what mostly occurs in your body. And the positive feedback is going to be going further and further and further away from the body. Questions about that? All right? So, this is trying to show you in a sense of their temperature. And the 22 is really in Celsius. But let's say the temperature of the house should be 68 degrees. If it goes too high, then something, you know, the AC will kick on and it'll bring it back down. If it goes too low, then it's going to bring it back to the 22 up here. Does that make sense? It's a thermostat of your body. That's what's happening, homeostasis. Okay? And like I showed you before, we're going to get into, I might as well start this a little bit now. What happens here is this. And let's just use this as an example. Normally what happens here is the hypothalamus is going to tell the TRH to come out, to tell the anterior pituitary to release TSH. That's going to tell the thyroid gland to release T3 and T4. That makes sense, does it not? Make sense? Now, what's going to happen here is that if this goes on all the time, which it would, are we going to increase this or decrease it? If TRH is always coming out, and that's going to tell the anterior pituitary to always make TSH come out, what's going to happen to T3, T, and T4? Is it going to increase or decrease? Increase. Good. Okay? It'll keep on going up. But as this keeps on going up, and T3 and T4 control metabolism, so it's actually going to make your metabolism go faster. If this keeps on going up, then your metabolism is going to be so fast, not a good thing. So we got to do something to bring it back down to what the normal level is. So this is what happens. High level T3 and T4 is going to send a message to your anterior pituitary and send a message to the hypothalamus and say, whoa, we got too much of this T3 and T4 here. We don't need any more. So it says, stop sending TSH, stop sending TRH. That's negative feedback. Right? But as you keep on doing that, if there's less of this, you're going to have less of this, right? Now the negative feedback goes away. Or it's going to say, look, we now have very little amount of T3 and T4. So now this is going to be going the opposite. It's going to turn this on and turn that on. You see what's happening? We've got this little teeter-totter here, thermostat, to try and keep that level of T3 and T4 at a normal pace. Does that make sense? Yeah? Now how do we apply this? Good question. about cancer. Now, there's two things about cancer you need to know. Rule of thumbs. If cancer occurs in some sort of organ, and if that organ normally produces things, let's say an endocrine organ, it's going to produce a lot of that substance. It's going to produce a lot of hormones from that there. Bigger gland, bigger hormones will get released. All right, rule of thumb. Okay. The other thing about cancer is that it doesn't listen to any rules. It does whatever the hell it wants. So let me ask you this. If we have a thyroid here and it becomes cancerous, what's going to happen to T3 and T4? Is that going to increase or decrease?
Increase.
It's going to increase, right? It's going to royally increase T3 and T4. These are up arrows. Does that send negative, or does that tell the hypothalamus to decrease the amount of TRH and decrease the amount of TSH? No. Think about it. This is where the cancer is. Not here, not here. So if this goes really high, because of the cancer in the thyroid, is it going to tell TRH to go down? Sure it will. Right? You don't care why this is going up. It's just going up. You have a lot of this coming out. It's going to tell TRH to decrease. It's going to tell TSH to decrease. But is it going to tell the thyroid to decrease? This is where the cancer is. It doesn't listen to anything. It's going to pour out a pot load of T3 and T4. It's going to keep on going up and up and up, despite the low levels of TSH and TRH. You see what's going on here? All right? So when someone has something called thyroid function test, they want to see what the levels of T3, T4, TSH, and TRH are. If you have high levels of this, and low levels of this, and low levels of this, hey, you know the cancer is at this level here. You see it? See how you're applying it? All right? We also have something, who here has heard of Graves' disease? Okay? Graves' disease does something similar. It's not cancer. But what it is that if TSH, right, this, and I'm just showing you what it is. If TSH looks like this normally, and this part here fits perfect, so now this isn't cancer anymore. Another scenario. But there is a spot here that this piece goes right in here. Goes in here, turns on the thyroid, and spits out T3 and T4. Like a lock and key. That's going to spit out T3 and T4. And that's how it works. But we have in Graves' disease, it's an autoimmune disease, meaning for some reason, we don't know why, but these people who have this disease make an antibody, which we'll learn about more, an antibody that, so an antibody kind of looks like this, Graves' disease. The antibody, that's my abbreviation for that, may look like this. It is not TSH. But the part that goes in the receptor looks exactly the same as TSH. So now your body's making a ton of these things, and it goes in here, in the bloodstream, and it goes into here, and turns on the thyroid. You now have an imposter that is not TSH, that is turning on your thyroid, and now you're going to make a whole potload of T3 and T4. When you make a potload of this, what happens to the amount of TRH? or down? If you have a lot of this, what happens to the TRH? Negative feedback, it goes down. What happens to the TSH? It goes down. Does this still pull our T3 and T4? It does, because this is turning it on. You see it? So you have thyroid cancer or Graves' disease is going to have high levels of T3 and T4, low levels of TSH, low levels of TRH. So how do you tell the difference between Graves' disease and cancer of the thyroid? That's where you go into special tests. Let's do an ultrasound of the thyroid, and you see some bumps over there. See the tumor? It's cancer. How do you test for this? Well, now you got to do a blood test to see if they have Graves' antibodies in the blood. This costs probably about $500 to do. An ultrasound of the thyroid is about $100. Someone has symptoms of high levels of thyroidism going on. We'll talk about those later. They want to do the thyroid function test first. We see this setup. The next test you want to do is probably the ultrasound. If there's nothing there, now go for this. Do you see how you're doing this? And this is how I teach. This is how I want you to understand not just negative feedback. I need you to understand how to apply this stuff. My exam questions are about this kind of stuff. If you know how to apply it, I know you know how it works. Let's do one more and I'll let you guys go. Let's do the opposite. Let's say there is a stroke to a person. And the stroke, which is a low level of oxygen going to a certain part of your brain. If you have low levels of oxygen going there, that part of the brain is going to get destroyed. Let's say you have a stroke that happens to the anterior pituitary gland. And when it does, the anterior pituitary gland, depending on how severe it is, gets destroyed. Now look at the situation here. In a person who has a stroke to this area here, what happens to TRH? Does that increase or decrease? We'll say it increases, right? Because we're going to start from the top. So this is going to go up. It tells the anterior pituitary to release TSH. Is TSH going to come out? No, because it's destroyed. So now this goes down. It royally goes down because it's destroyed. What about T3 and T4? Does that come out or not? No. So this is going to go royally down. If this is really low, negative feedback occurs, but what is it going to tell the hypothalamus to do? Make more or less? We need a lot more T3 and T4. We've got to go right to the start. What is it going to do to TRH? It makes it go up, all the way up. Because it's low levels of T3 and T4. This is going to tell the anterior pituitary to release TSH, but you can't do it. Now, look at the scenario here in terms of a thyroid function test. High levels of TRH, low levels of TSH, low levels of T3 and T4. You know the bad part is happening at this level here. You see how you're using this? All right. Questions on that? All right. So there's a picture of what I kind of drew for you, TSH and RH. But keep in mind, it can get busy. What I did for you is just one aspect. I could show you another aspect, and when we get into reproductive system, you could appreciate what the postmenopausal is all about when you have low levels of estrogen. You can do that on your own, but we'll do that when we get to reproductive. Okay? Positive feedback. Just really fast about positive. I'll give you one example of a normal thing of positive feedback. Pretty easy to understand. The set point of his cervix, the opening to the womb, is closed. That's what the set point is. All right? That's what it wants to stay in. When a baby's starting to come out, that cervix, the opening to the womb, is going to start to open. It's going further and further and further away from the set point. But that's an okay thing. It sends a message to the brain saying, hey, brain, we're trying to get out. And the brain says, okay, I'll give you more pain. And that's a positive feedback to push the baby out, to get that open. So that's what that is all about on there.